Knock, knock. Hello. You must be baby Jack. I'm Sarah. I'm a nurse practitioner student, and you must be mom, and your name is Mary, right? Okay. So, as we mentioned before, I'm going to be doing a focus exam on the head and neck. And has Jack been examined before by a provider? Perfect. And did he do okay? Good. Do you have any questions before I begin? Perfect. So just looking at Jack right now, his head is normal cephalic, his face is symmetrical. It's going to feel here. No lesions or masses noted. The anterior fontanelle is open, it's flat, very normal. Conjunctiva is pink and moist, sclera is white without injection. Gonna take a look at Jack's eyes, his pupil response. Good, good. Gonna take a look at the light, follow the light, Jack. Good. Eyes perla. The corneal light reflex is normal. It's going to go ahead and dim the lights. We're going to do a quick fundoscopic exam. The red reflex is noted. The optic disc is visualized. Clear borders on both sides. No papilledema or cotton wool spots noted. And he said that he was pulling at his right ear, right? So we'll start with the left ear. He doesn't seem to have any pain or irritation with the tug test. We're going to take a quick look inside. TMs, pearly gray. Landmarks are visualized, cone of light is visualized. No fluid or bulging or erythema noted in this ear. And this was the ear that was causing him a little bit of pain. I see he has a little bit of discomfort on his face there. And take a look at this ear as well. Slight cerumen in this ear, kind of partially obstructing the view of the tympanic membrane. But from what I see, the tympanic membrane is bulging, it's erythematous, and I see a little bit of fluid in there. We'll talk about that in a second, Mom. The nose appears symmetrical, the septum is midline without any deviation. The nasal turbinates are pink and moist bilaterally, no polyps noted. I'm going to have Jack try to open his mouth there. Good. The oral mucosa is pink and moist. No lesions noted. Good dentition. Go ahead and stick out your tongue, Jack, if you can. Good. Tonsils +2 without any exudate or lesions. Oral mucosa is good, pink and moist. I'm going to quickly feel the lymph nodes here. Pre-auricular, the post-auricular, occipital, posterior cervical, tonsillar, submandibular, submental, anterior cervical. The thyroid appears smooth without any masses, supraclavicular and infraclavicular. Perfect. So Jack had a very healthy exam, except for the otitis media that we kind of discussed in the right ear. He does have a little bit of cerumen or earwax kind of built up in that right ear as well. And what I'd like to do today is kind of remove that so it doesn't keep building up. And then, like, because of the infection and the fluid and the pus, I don't want it to get stuck in that earwax and cause further problems for him in the future. So it's a very quick procedure. It'll take about 15 seconds at most. I'm just going to have it's like a little instrument. It looks like a little hook a fishing net without the net. It's just a little ring. I'm going to put it inside the ear and gently scrape the cerumen and then pull it out. It's a very simple procedure. What I'm going to have you do is kind of place him on your lap, his back against you. You're going to bear hug him and kind of hold his head in place so he doesn't thrash about when I'm doing it. There's very minimal risk. It's mild, maybe mild discomfort and pain during the procedure. He shouldn't have any bleeding or drainage after that, except from the ear infection that he has. There's a slight risk of perforation of that eardrum, but it's very minimal risk because the cerumen, I visualize it's right, not even close to that eardrum there. Do you have any questions for me? Do you have any concerns about the procedure? Okay. Do you agree that we should move forward and take that out before it becomes more of a problem? Perfect. All Alrighty, I'll be right back. I'll grab my instruments. I'll be right back. Alright, thank you.